Okay, here we go. So, welcome again. My name is Laura Santner, for those of you that don't know me, and I am a therapist here on skinpick.com. And I've been doing these Q&As for a really long time, and it's really a great space to be able to ask any questions, and hopefully, I'll have an answer for you. And feel free to ask anything, and it's going to be pretty casual and relax, have fun. Um, it's fall season right now, so maybe you have a pumpkin spice latte with you while you are joining me today, or some pumpkin pie, or a fidget. I brought in a little. This is supposed to be a pumpkin, so this is a little pumpkin poppet. I don't know if you can see, but yeah. So hope you have your fidget. So I'm going to go over the most commonly asked questions first, and then the pre-submitted questions. And then anytime you have any question, just write in the Q&A box, and then I'll get to that right after. Okay, so let us get started. So the first commonly asked question is, what causes skin picking? So the cause is not entirely known, and it's rather complex, but basically, research says and is indicating that people with skin picking disorder has a inherited genetic predisposition. However, even if there's an inherited predisposition, there are still other factors involved. So, such as your hormones, temperament, the age that this starts, any potential co-occurring disorders as well, and environmental stress factors. So it's caused by a lot of different things. So even if you have a genetic predisposition, it doesn't mean you are going to get a skin picking disorder. And even if you don't have a genetic predisposition, it doesn't mean that you're still not going to get it, because there are other factors. So it's like this combination of factors. Okay. Um, so I hope that answers that. What kind of therapist do I look for? So the best kind of therapist I would recommend is one that is trained. And I know it's hard to find a trained therapist in this field. Um, but we exist, and you could look for a trained specialist on certain websites. Skinpick.com does have a list of trained therapists in addition to their own program. Of course, everyone is trained in that program. Outside of that, you can look up trained therapists on organizational websites such as bfrb.org. The Changemakers, I believe, are starting their referral resource list as well. So I recommend looking at some of those places to find a trained therapist. So when I say trained therapist, what does that mean, right? So a trained therapist is someone that is of familiar with specific modalities of treatment. So those modalities include the comprehensive behavioral model. So it's called COMB, comprehensive behavioral model. The other thing that you want your therapist to be aware of is acceptance and commitment therapy, or ACT. Also, habit reversal training, HRT. In addition to regular cognitive behavioral therapy, CBT, and dialectical behavioral therapy, DBT. So, whenever you're talking with a new therapist, it's not just, keep in mind, it's not just one treatment modality that is going to be helpful. So you want a therapist that is familiar with all of these and then some. So it's a combination of treatments that typically are most effective. Okay. By the way, the most important thing, though, when you are looking for a therapist, is finding one that you're comfortable with. Um, so definitely make sure you have that connection first. Okay. How common is skin picking? It's quite common, and more common than we realize. So right now, statistics are saying that there's 1.4% of the population has specifically skin picking disorder. Um, that was in, I think that statistic was from the DSM 5th edition. However, more recent findings show that actually it's more like 2 to 3% of the population. So basically, that's about 1 in 20 people. And even with this percentage, there's still even more because so many people don't report it and it's not recognized. So because of this sense of shame and isolation, um, people don't know that and people don't know it's a thing. So that percentage is even higher. But right now it's about 1 in 20. Okay. See. Is dermatillomania a lifelong struggle, or is it possible to stop? So, dermatillomania, also known as skin picking disorder, right, or excoriation disorder, it's a chronic disorder. So, what that means, unfortunately, is that there is no cure. Um, So, yes, it is lifelong. However, that doesn't mean that it's going to be active forever and lifelong. And it doesn't mean that it's going to interfere with your life. Um, so, yes, you can reach a point when the urges become dormant. So they're no longer active, they're not bothering you, they're not resurfacing. So, and also the more that you're aware and the more that you learn different tools to manage, the better prepared you're going to be for when those urges do come up. So it doesn't mean that you're going to actively have urges your entire life, and it doesn't mean that you're actively going to be picking your entire life. But yes, within your body, it's going to be a part of you because it is chronic, but it is not going to be the entire part. Right? It's just one little part. Are there any skin treatments available to remove the evidence of picking? So scars left from picking can range, of course. So they can be quite minor and can go away in a couple of weeks. And then there could be some more serious ones that might take longer. So, for example, like 18 months. And if there are different factors that can impact that, so if there have been any infections or skin tissue damage, that can lead to more complications and for it taking longer to heal. Right. Um, so what can be done, right? So if you're not actively picking, of course, have patience, be gentle with yourself, give it some time, um, and see what happens. You can consult with your dermatologist if there are some concerns, and there are options that you can explore if it's something that's bothering you. So, for example, there are different kinds of creams and ointments and silicone pads that can help with scarring. Um, and then there are more invasive procedures that you can do to help with scarring, such as laser and even more so would be skin grafting options. But start off with creams and ointments and silicone pads and talk to your dermatologist if you have concerns. Okay. I see some questions are starting to come in. I will be looking at this later. Very good. I'm just quickly scrolling the live ones. And if you have any concerns, just a reminder, this is recorded, but no, I cannot see anyone. I cannot see you. I'm just staring at myself. Um, so this will remain anonymous. If you ask questions, it is anonymous. Even if you have a name that you signed up with, I am not reading your name. I'm just reading questions. So everything is anonymous. Okay. So let me go back to these questions. I think I want to go to this one is a really good question that we get a lot. I have heard that NAC can be used to help with skin picking. What is the dose and is there a recommended brand? So So NAC is N-acetylcysteine, and right now that is the most recommended. It's an amino acid supplement, and it's showing that it's the most promising so far, and it is the one that has been the most researched. So right now, NAC, N-acetylcysteine, is the one that's most recommended specifically for BFRBs. And when they did the research with NAC, they used the brand Swanson. So any brand is fine, but that's just the one that was researched. So that's the one that I tend to suggest. I'm also familiar with the brand now, and I like that brand as well. No rhyme or reason. It's just it's a good brand, and I've known a lot of people that have taken NAC, Swanson, and now and have had no issues with it. So that's why I tend to recommend those. There are very little minimal side effects. It's just an amino acid supplement. So the risk is pretty low. The dose varies. So dosaging, they typically recommend starting off at 1,200 milligrams, and they come in 600 milligram tablets, so you can take it either all at once or twice a day. It can be helpful to break it up because it's short lasting. So like 600 milligrams, let's say in the morning, and 600 milligrams like in the late afternoon or something like that. Studies have gone up to 2,400 milligrams. So if you're not feeling anything at 1,200 milligrams, feel free to increase and experiment a little bit. If you have some concerns about that, it's always good to talk to a doctor or a pharmacist just to be sure, especially if you are taking other medications. Always good to be on the safe side. Please consult with your pharmacist or psychiatrist or doctor if you want to take NAC, even though it is over the counter. And yeah, it's pretty short lasting. It can stay in your system about 8 to 10 hours, which is why it's recommended to break up the doses. And for some people, they feel like it only lasts in their system like 3 to 5 hours. So break up your dose and give it a try if it's something that interests you. Okay, I hope that answered that question. Oh yeah, this is a good one. Are there common triggers that I can avoid? And what can I do to not pick? So basically, basically there are a lot of triggers, as I'm sure you're all well aware of. So I recommend starting off tracking if you're not doing so already, and doing some self-monitoring, and that could help kind of pinpoint your specific triggers. But ultimately, the common things that happen is that people become either overstimulated and or understimulated. So any trigger that's overstimulating or understimulating can trigger urges. So what that means basically is like stress and feeling overwhelmed, like that's overstimulated, versus when you're bored, which is understimulated. And triggers can also range from sensory triggers, so what like skin looks like and feels like, cognitive triggers. So what are some of the things you're telling yourself? What are some of the thoughts going on in your head? And sorry, I thought my mic wasn't on for a second. Affective triggers, so how you're feeling really impacts your urges as well. Motor is kind of like your body positioning. And then place is where you're located. So are you in the bathroom? Are you in front of the mirrors, for example? Okay, so depending on your trigger and the situation, you can do different things, right? So if we kind of look at the specific sensory cognitive affect motor place, also known as SCAMP, right? You can kind of think about different strategies within each of those categories. So, for example, sensory strategies could include different fidgets, right? A little pumpkin fidget, for example, for today. Cognitive strategies can include kind of being mindful of what you're telling yourself, right? And rephrasing thoughts. Um, if needed, that's a really powerful cognitive strategy. Effective strategies can include like helping yourself express your feelings. So through breathing, relaxation exercises, something creative like writing and art and music, right? Exercise. Those are really great ways to get your emotions out and express them. Motor strategies. So some examples of motor strategies can include blocking yourself, right? So if you're in a certain position and you're getting an urge, you want to block yourself. So barriers are really good, um, such as gloves and tape, band-aids, long sleeves, for example. Those are really good motor strategies. Place strategies. So um, if you're noticing your urges are happening a lot in the same place, like the bathroom, right in front of mirrors, change the lighting in the bathroom, cover the mirrors. If it's while you're watching TV, sit in a different spot, on your couch, sit on the floor. So you're changing your environment. Okay. So these are just some examples, some potential triggers, and some potential strategies to try. Okay, just to get you started. We can have a very, 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 very long discussion on all of this. That can go quite in depth. Yeah, is my skin picking a BFRB or a tick disorder? This question has been coming up a lot recently. So they might look similar, ticks and skin picking, but they're actually quite different and they have different causes, and they function differently, and they have different treatments. So basically, ticks are involuntary, right? And they are often linked to neurodevelopment issues such as Tourette's. They are sudden, they're rapid, and they can be repetitive movements or sounds, right? And they can fluctuate in times of stress and when you're feeling tired, if you're feeling anxious. BFRBs, um, even if it is automatic, it is, and it might feel involuntary, it's not actually done involuntarily, and it is done with intention to self-regulate. So when you're faced with certain discomforts, right, such as boredom or anxiety. So BFRBs is for self-regulation, and with intention. The goal is directed, and so even if it's happening and you're not aware, it's still, the goal is still for self-soothing, um, and management of emotions instead of involuntary. Okay. Research shows that BFRBs also involves different areas of the brain. Um, and it's kind of more related to emotion regulation and reward processing. It's also showing that serotonin and glutamate are involved in BFRBs, and it is not so far involved in tics. Okay, so that's just a little bit of an example of some of the differences. So I hope again that's helpful. Let me see. My daughter, who is 18 years old, this is one of the pre-submitted questions. My daughter, who's 18 years old, has skin picking behaviors, but does not want to talk about it with myself or a therapist. I'm struggling with how to support her given that she doesn't want to address it with anyone. I've tried sharing my struggles with the same thing in the past, and I've tried to normalize the struggle and reduce the stigma. Good. But I'm at a loss of how to support her when she doesn't want to talk about it. Any ideas or thoughts would be appreciated. Yeah. So, I mean, it sounds like you're already being supportive and you're being there, and you showed your daughter that you're there and that she can talk to you if she wants to, or if she needs to. And that's so great that you've already made efforts to try to decrease that sense of shame and that stigma, and that you could relate. So already that's such a powerful bond that you've made. And you've already shown that you are there and that you are supportive. You know, part of support is just being there, encouraging her to live her life, engage in the things that she enjoys, and just being a loving parent, which you're doing, right? You love her no matter what. So let her take the lead. And if she does not want to talk about it right now to you or to a therapist, that's okay. You know, when she's ready, she will let you know. So giving her space is a way of offering support, and it actually goes a really long way, and it will be very much appreciated, and she knows that she can talk to you when she needs. um so that's what I would recommend. Yeah, even though it's maybe uncomfortable for you as a parent, because of course you want to do as much as you can, but sometimes what you can do is to not do anything and just let her take the lead. Okay. So I hope that that was helpful. Those were the commonly asked questions and the pre-submitted questions. So I'm going to jump to your live questions right now. Let me see. Just have to move some screens around. Um, okay. So, so do you recommend mindful-based cognitive therapy for skin picking disorder? Additionally, from other therapy modalities? Yeah, why not? Right? um, like I mentioned before, there is not one thing, there's not one modality that is going to work and is going to be the magic answer. So if you can find that magic combination for you, go for it, right? Mindfulness plays a huge factor in treatment because awareness is key. When you are aware, then you are better able to be prepared for certain situations, and aware of what's going on. So absolutely, give it a try. Mindfulness based cognitive therapy. Um, Try it, and I hope that it's helpful for you. Could therapy also help my daughter who has eczema? So, um, if someone has eczema and a skin picking disorder, it absolutely makes it a little bit harder because eczema is very sensory. So that's a huge trigger. So it's also very common. So if you have eczema and a skin picking disorder, I absolutely encourage you to get treatment just like everyone else. What adds the layer is you want to make sure you're connected with a dermatologist to treat the eczema, but then talking to a therapist as well to treat and help with this with the skin picking part. A dermatologist is not going to be able to help with skin picking, but they're going to be able to help with what the skin looks and feels like, which is going to impact urges. So yes, um, try therapy. Eczema also, by the way, tends to break out more when you're feeling stressed or anxious. So having someone to talk to is always helpful. Yeah, so for me, it helped to restrict acting on urges to one area, my ankle, for example, to reduce its size gradually. Now I don't pick, but here for my daughter. Great, that's wonderful. Congratulations. That doesn't always work for everyone. Sometimes when you resist one area or focus on one area, it can pop up in another area. It likes to find its way to get your attention. But when you're working on managing skin picking, it can be pretty overwhelming. So focusing on kind of one area of the body at a time can also be really helpful. So I'm really glad that that was helpful for you. And I'm glad that you're able to be there for your daughter. Oh, once there has been a skin pick, is there a best skin application healing approach? Example, antibiotic ointment or Vaseline. Um, it depends on what your skin looks like after. So if there are open wounds, for example, I would use an antibiotic ointment. If there are no open wounds, I would recommend Vaseline. I went to this conference and spoke to a dermatologist one time, and the dermatologist was going on and on about Vaseline. They were recommending Vaseline, Vaseline, Vaseline. So I would say both, just depending on what the skin, how the skin is looking and feeling, and both are very helpful. Um, but there is no best product, I would say. I think you're on top of it. Antibiotic ointment, Vaseline, perfect. You're good. Oh yeah. So someone's writing, "Oh, hi in the UK." Um, what's wonderful about this is people are joining us from all over the world. So glad we can have this opportunity to gather together. I feel like I'm picking normally late in the evening, when you go to bed. Yes. So that's a really common time for urges to be strong because you're tired. Being tired is a really big trigger. And not only are you tired, but your brain is like typically going a mile a minute thinking about the day and thinking about what you have to do the next day. And oh my goodness, you feel so overwhelmed and you just want to go to sleep, but you're tired. But maybe you have to still do XYZ. So those are those urges are night can be strong. Yeah. So think about what can help you to work on that night transition. What can help you to slow down? Um, and ease into the evening. So that might be maybe an evening shower. Like, what is your routine? Having some tea or hot water and lemon hot water in the evening. Maybe doing some night stretches. I really like doing body scans when you're in bed, because usually you wind up falling asleep. And it's just a nice way to kind of be in tune with your body. So think about what your night routine is and try to be consistent, to help with some of those urges. And dim lights, for example, also as you're getting ready for bed, nice way to stay calm and calm the body, calm the mind. Oh my goodness, what is the full name and spelling of the NAC medicine? Uh, I'm not sure I can just spell it off the bat. I'd have to look it up, but if you look up NAC, you'll find the spelling. But it's pronounced it's N dash acetylcysteine. So if you're looking it up, NAC N dash N acetylcysteine. Okay. Um, oh, and they're asking about seeing the full dialogue. I have captions on. I hope you can see the full dialogue. I'm not sure how that works. But if it's not working, or if it's not working correctly, I guess email us at support@skinpick.com so we could figure out the settings for next time. And again, you can always watch it again on YouTube later if you need extra time watching it. And I think YouTube also has a feature, I believe, where you can make sure that there are captions. So I'm sorry about that, and I hope we can get that fixed. Wow, this person's saying I started terzepatide. I'm not too familiar with that one, and my skin picking pretty much stopped. That's amazing. I'll have to look up a little bit more about that medication. I have not heard too much about that. Um, or maybe there's another name for it. But that's really good information to know. Thank you for sharing. So this person has started TIRZEPATIDE, and their skin picking has pretty much stopped. That's wonderful, and exciting. I have had lots of therapy, CBT, DBT, etc., for eating disorders. I practice mindfulness and yoga. I take anti-anxiety medication. My triggers include anxiety like travel, yep, change in routine, yep, foods, an amount of exercise. Okay, I pick at my cuticles and have for so long that my nails and beds, yeah, are destroyed and disfigured. That can happen. Um, I also pick at my heels. I end up majorly embarrassed. Yeah. What else can I do to control the urges and fighting them? So, my first reaction here is I'm aware of the word control and fight. And that's a common way of thinking. I think most of us think that way because that's how it feels, right? But if we were to rephrase that, it actually makes a big difference all on its own. It's not about controlling the urges and fighting them, um, because the urge will win. To put it simply, when we fight and try to control, it is going to kick back and fight back, and it's going to be harder. So instead, I like to rephrase it to managing. So, what else can I do to manage the urge, not control, manage, and work with them? Right? When you work against them, fight it, it does not work. When you work with them, when you try to understand them and what they're trying to tell you, that's what is helpful. So I would start from there. So it's about managing them and how can you work with them? Okay. Um, so it's great that you've already worked on this with a variety of modalities, but hang in there. It sounds like you're already doing some great things. I would suggest if you have not done so already, I'm a little unclear if you've worked specifically with someone who is trained with skin picking. So I would suggest that because then you can kind of really go into some of the details of your stressors and your triggers, and what's going on and figuring out what is your body trying to tell you when you have urges. Okay. So hang in there, look at some of those resource lists. Like as I mentioned before, such as bfrb.org, or join the program, right? Skinpick.com can be really helpful. Okay, I'm loving these questions coming in. Okay. I did see a hand raised briefly. Just a reminder, I'm not able to call on you individually. We are keeping this anonymous. So if you have a question, just write it in the chat. No names will be mentioned. Even if you signed in with a name, I'm just reading your questions. Ooh, is skin picking something you could learn from watching someone doing it? What I mean is, if I'm a mother and I suffer from skin picking, will I risk to pass this behavior on to my child? So, yeah, this is a common concern. And there are a variety of factors that can bring on the skin picking disorder. So, just because your child sees you doing it does not mean they're going to develop a skin picking disorder. That said, depending on the child's age, yes, they might copy you, but it doesn't mean it's going to become anything. It's not gonna, just because they see it doesn't mean it's going to pass it to them. Not that alone. But that combined with potentially that genetic component that we talked about, combined with other things that are maybe going on in your child's life, could potentially trigger it. So it's the combination of things. It's not just the one thing. So don't worry too much if your child kind of sees you picking here and there. Um, I wouldn't worry about it. It's that combination of factors. There's nothing you could really do, unfortunately, to prevent it from emerging. I'm continuing to pick at a spot on my nose and want to use something to keep from continuing to pick at it and make it more red. And I'm wondering if it's better to let it be as it is, even if it's red and makes me very self-conscious in order to heal rather than using cover up. So um, if you're using makeup to cover up, make sure that it is paraben free, you know, if it ideally organic as possible. Um, if there's a little bit of redness, I think covering up is fine, but if you're noticing that it's irritating it more, I would try to avoid using makeup just to kind of let it air out and breathe. Different makeups can be more irritating to the skin. So you just have to, know your skin and know how it reacts to makeup, or just use the makeup less frequently. So, for example, maybe if you're going out, put on some makeup, but if you're more comfortable, but if you're in, take it off. Really, it's about what is your comfort level. So I would say that's what's most important. Um, the redness will go away. You can also think about, if you're home, some barriers. So like we talked about, like gloves, for example, so you're not picking at your nose. You can even put some Band-Aids or like mighty patches if it's a certain spots. But again, don't use anything if it's going to irritate your skin further. So it might take a little bit of experimenting, but when it comes down to it, do what makes you feel most comfortable, and helps you to feel most confident. Okay. Is there a best recommended treatment to lighten scars or dark spots from skin picking? So there are over the counter things that you can try, not necessarily, I don't have like a recommended brand, but things like silicone, they have silicone pads or patches. Usually those tend to work pretty well at lightening scars, or dark spots. Um, so those are just over the counter. If you want something that's more specific, I do recommend going to a dermatologist because they can give you a better recommendation. They can even give you a prescription because sometimes there are creams that you can put on areas just to help lighten and to help to heal. Okay. Oh, good. Someone else is saying captions are working. Okay, good. Thank you. Thank you for letting us know. Hmm. Yeah, so the tirzepatide is a GLP-1 medication. Okay. Yeah, we'll have to look that up. We'll have to look that up a little bit further. And if there's anything we need to get further information on, no, I'm going to write it down for myself. Tirzepatide. We can always get back to you further and follow up on, if you email us at support@skinpick.com. What is the most recent research say about the comorbidity of skin picking and OCD? Whoops, I made that too big. Yeah, that's a really good question, and it's a common question, because it's still in the category right now in the DSM. It's in the category of OCD and related disorders, right? But it's not actually OCD. So someone can have, so they're different. I kind of describe them as being cousins. So someone can have OCD and not have a BFRB. Just because someone has a BFRB does not mean that they have OCD. So they are different. There are some similarities. That's why they're kind of in a similar category, and they're kind of like cousins. They're treated differently, and different medications. There are medications for OCD, for example, but there are no medications for BFRBs, or FDA approved medications. So, um, you know, as an example, so OCD, so BFRBs can be treated with like we talked about before, like CBT, COMB, ACT, DBT, HRT, right? OCD is treated with exposure and response prevention, ERP. So different treatments. Um, BFRBs do not respond to the same medications. As there are no medications, unfortunately, like we mentioned, NAC right now is the most promising one. Okay. OCD involves obsessions that increase anxiety and compulsions that then reduce or try to reduce anxiety, right? At least temporarily. So people with BFRBs um, do not have these obsessions. So, for example, they're not thinking, if I don't pick at this spot, um, then something bad is going to happen, right? It's not That's not what's happening in the mind. Instead, I'm picking the spot because I'm uncomfortable and I'm trying to self-regulate myself. So it's a little bit different from OCD. Um, so I hope that clarifies it a little bit. It's it's a potentially complex, a little bit more complex of an answer and a topic. I believe that we've done actually a webinar specifically on OCD and BFRBs. So check that out because that really goes a lot more in depth. But this is just, you know, a basic answer, a beginning answer to get you started. Um, so I hope that sets you off in a direction. Okay. Oh, someone's following up again on the tirzepatide medication. So it's in the category like Ozempic, uh, Monjaro, right? Some research on addictive behaviors has been helped. Yes, yes. So I have seen a little bit of that. You're right, and I think it's kind of also related to that glutamate within the body. So yes, so now that you say that, yes, so I have heard of that. And I've heard that for some in that category, yes, it has been helpful, but again, it's not researched enough, so it's not something that I necessarily would outwardly make a recommendation. There needs to be more research, but it's promising and exciting. So medications that treat like addictive behaviors can potentially help with skin picking. But we'll see. We'll see where the research brings us. I am 32 and have been biting my nails and especially picking my skin around them for as long as I can remember. Yep, I went through about 20 sessions of CBT last year, but unfortunately, I can't say I made any progress. Right. One major struggle for me was the ability to actually write down my thoughts and emotions, in which picking was happening. I never really knew what to write, and it seemed to me to have a daunt to seemed to me to be such a daunting task. I also have ADHD and I'm quite hopeless. Oh, and how to progress. Any advice? Yeah. So, um, it, as I mentioned before, CBT alone is not going to do anything. And especially in like 20 sessions, like this is not something that's going to just go away. It's something that's an ongoing process. So doing one modality for a time period is not going to be a magic answer. Unfortunately, there is no magic answer. So I would say, get into treatment with a therapist that knows about BFRBs, that is not just doing CBT, that's doing a combination of things to kind of help. And you're right, when doing tracking and focusing on tracking, those thoughts and emotions are probably the hardest part of tracking. Uh, but that's okay. Even if you don't know, just the fact that you're taking that pause to think about it is helpful. So it's okay if you can't identify the thoughts and the feelings. If you keep practicing it, you might over time. Again, it takes more than 20 sessions. It's ongoing practice. So keep taking that pause and keep thinking about it. If thinking about thoughts and feelings might feel too overwhelming, you can rephrase that. So, for example, what is my body trying to tell me? Right? What does my body need right now? So, if you look at it from that perspective, that might help you to figure out what the thoughts and the feelings are. Um, so, what is my body trying to tell me? What does it need? Okay. Having ADHD as a co-occurring disorder is quite common. You are not alone. So I understand why you would feel hopeless, but hang in there, right? ADHD is a lot of about overstimulation, understimulation, right? And same with BFRB. So it is a very common co-occurring disorder. So I suggest working with someone or joining the SkinPick program. So you're working with someone in a typing based sense. So either virtual, in person, typing based. Just having someone who knows about skin picking disorders and BFRBs and is able to walk you through it step by step and help you on your journey. So as things are coming up, you have someone to talk to. But there's lots of things to do. So hang in there. Yeah. Yeah, so I kind of answered this question before, but I'll repeat it. So do you think skin picking can be totally resolved in time if one works on it, or a person can just learn how to manage, control the urges, but they will remain? So this is a chronic disorder. So what that means is a part of it will always be with you. Um, but that doesn't mean that it's always going to be active. So can it be totally resolved? I think I think it depends on your definition. Um, it can get to a point where you can learn to manage it, where you won't have urges, or the urges will be very low and be easier to manage. Or they might just pop up here and there, and you'll be like, oh, I haven't had an urge in a couple of years. Oh, that's interesting. That's uncomfortable, but you're aware of it. Okay, I guess I gotta take out those strategies again because I'm experiencing those urges again. Um, so it doesn't mean that it's always going to be active. It doesn't mean it's always going to interfere with your living. But a part of it will be with you. Um, so there is no cure, and it just kind of depends on how you feel resolved. What does that mean to you? Okay. I think I would say a goal is to feel better about yourself, confident, and not to feel shame, not to feel isolated, comfortable in your skin, um, no matter what your skin looks like, and feeling good about that and not letting it interfere with your living, and with your enjoyment of activities. Okay. Hope that answered your question. Um, How does NAC work? Well, you'd have to you'd have to look up the scientific answer to that, because there's lots of jargon, which I am not good at and cannot repeat, unless I look it up and read it to you. So I would look it up. There are lots of really great articles uh, about NAC. There are some great articles on skinpick.com, in fact, about NAC, so you can get a little bit of a better understanding about that. Overall, it's an amino acid supplement, and research is showing that people with BFRBs are basically lacking, I believe, amino acids, and it's impacting our amino acid levels. So NAC helps kind of fill that gap and helps to regain balance. And it kind of feels like when you take NAC, it's kind of almost feels like if you hold your breath and you feel this tension all the time, and then you take NAC, it kind of feels like you take a deep breath. Um, if it's effective and working, that's kind of what it feels like. It feels like a release. It feels like a lot of that tension has been lifted. Um, but I would look it up to get a little bit of a better scientific jargon answer. um, and if you can't find it and you can't find that answer or you don't understand that answer, again, email us at support@skinpick.com and we can try to translate it for you and better explain it. Okay. What did you say was the recommended brand for NAC? So there is no recommended brand, but the brand that was researched and cooperated with research was the brand Swanson. So that's one that I tend to go more towards recommending just because that was the one that was cooperative and was researched. Swanson. The other brand that I like and have experience with and have heard good things about is the brand Now, NOW. Any therapy approaches um, that you would think would either better or worse for people with ADHD and skin picking disorder? Any good resources also to understand better how they work together and the implications of that? And does a therapist need to have experience in both? In my experience, many therapists have a rather superficial understanding of ADHD, and I wonder whether that's important when treating skin picking or not really. Yeah, I see your concern and I see your point. The treatments for BFRB are the same even if you have ADHD. So it's that same figuring out that combination that works. But yes, there's going to be special attention or extra attention to things like overstimulation and understimulation and structure and organization. Um, so so the approaches are the same, but potentially a little bit more focus on some aspects that pertain to you. Resources, there are some really good books out there. Let me see. I have a couple written down. Let me just see if I can scroll. If you want to kind of not necessarily resources for ADHD and BFRBs, but just BFRBs in general. Again, having ADHD along with BFRBs is really common. So let me see. Where did I? Okay. So you might want to check out, let's see, Overcoming Body Focused Repetitive Behaviors, a comprehensive behavioral model for hair pulling and skin picking. So that's by Charles Mansueto and Sherry Mansfield and Ruth Gollum. That's kind of like the the main resource guide, I would say, of information. I would also, if you're looking to kind of work on your own with this, there are two more recent workbooks that just came out that I would recommend. The BFRB Recovery Workbook, that's by Marla Deibler and Renee Renardi, two very well-known people in the field. There is also a newer book. I'm not even sure if it's officially out yet, or it might be out really soon. It's called the BFRB Workbook for it's more for teens and young adults. But I think that could also be helpful. And that's by Lauren McKinney, who's actually just we just had a webinar with her here at skinpick.com. And she is a skin picker and she started the organization pickingme.org. And then the therapist, Dr. Laura Shax, CHACKES. So those would my cat's meowing. I don't know if you can hear my cat meowing. So those would be some workbooks that I would recommend if you want to try to explore on your own. Um, but I would recommend, so for example, if you decided you want to check out um, um, skinpick.com, those therapists, yes, are trained in both BFRBs and can, yes, trained in ADHD. So that would be a good resource for you. If that platform works, it is like typing text based. So it works for some and it doesn't work for others. It just depends on your needs. Um, but yeah, so when you're searching for therapists, when you're researching, call them up and ask. Yeah. Um, I would definitely recommend still focusing on the trained BFRB, because just because someone is trained in ADHD does not mean they're trained in BFRBs. So I would recommend a BFRB specific therapist, not an ADHD therapist, because a BFRB therapist is more likely to know and understand how to also work with ADHD since it's so common. Again, an ADHD therapist is not going to know how to work with PFRBs. So stick with someone who specializes in skin picking and BFRBs. Okay. I hope that answered and clarified a bit. Um, okay. We are coming to time. Are there any other questions? Questions, comments, concerns, complaints? Oh, yeah. So have you read the book Skin Picking: The Freedom to Finally Stop by Annette Pasternak? Um, I have not read it. But yes, that is a book. That is a well-known book, and a well-known author. So so check it out. Yeah. There are a lot of books. I have a very long list of recommended books. Um, yeah, do I recommend it? Go for it. Go for it. You never know what's going to help. So as long as, you know, if I say if anything is related, is if anything is a method of helping that is not going to hurt you, try it. Because you never know what's going to work for you. And anything that you're doing is still an active step. Any active step is a way that you're helping yourself. So yeah, check it out. It's always good to take steps. It helps you to feel like you are doing something, which you are, and it makes a difference. Yeah. So thank you for adding that. Oh, you're welcome. Just wanted to say thank you for doing this webinar. It was really helpful. Oh, it made me feel less overwhelmed and less lonely. Yes. And that is our goal, because this can be so overwhelming. And you are not alone, and people don't realize that. And again, we have people joining us from all over the world. And by the way, another way to feel less alone is to join a support group. Ideally in your area if there is one, but there are also many virtual support groups out there. So I definitely recommend that because you can help to feel like you're not alone, and you see other people and you meet other people and you see, oh, other people get it and other people have the same experience. So definitely recommend that. But if not, that's okay. We're here. We have webinars every month, and we do these Q&As about every other month. Okay, so we are here. What's a small thing, quick win you would say is a good first step to making progress? I mean, you're on this webinar, right? There we go. That's one small thing. That's a quick win. You did it. You came. You listened. You asked questions. Right? You're engaged. You're aware. Um, right there. First steps making progress. So you are there. Is there a cost connected to the skinpick.com website? So these webinars are all free, to get access to any of their blogs, their articles, that's all free. I'm not, if you want to just use their tracking app, I'm not sure. about it used to be free and then it wasn't free. And then, so now I'm not quite sure about the tracking app specifically. But if you want access to a therapist, yes, there is a monthly charge. And if you want, there's a monthly charge for unlimited therapist um, communication. It's or every 24 hours because everyone's around the world. So communication is every 24 hours, and unlimited is the main option for skinpick.com. The other option is I think you can do once a week or twice a week communication with your therapist. That's like the next tier. Um, and then there is an option of just, well, I think, I'm not sure if you can do the option right off the bat, but there's a resource only option as well. So you can kind of get the resources and have no therapist interaction. And then that's another tier option. So there are lots of options. So I would contact support at skinpick.com to find out more about what your options are and what seems reasonable for you. Um, Can ERP, exposure and response prevention for OCD, help with skin picking as well? No. Nope. No. Unfortunately, I mean, yeah, different treatments. Yeah, so nope. Short answer is nope. Oh, another win. I think this is what this question is asking. What is another win? Oh my goodness. Well, we already said you're here. You're engaged, you're asking questions, and you are aware. So that is a win. Those are big wins. And I think, another win is just that's simple that you can do is getting more information, right? Read some of the blogs, join more webinars, join a community, get more information. And that's a way of helping you to feel better about yourself, and getting more information. Information is power. Oh, someone's here from Denmark. Hello. So glad that you like these webinars. Oh, and they're so important. It helps a lot. Good to hear. Thank you so much. Thank you for joining. Another one. Thank you so much for an excellent webinar. Oh, you're welcome. Thank you so much, everyone, for joining. Yeah, we have these again pretty regularly. The question and answer is about every other month, and we have other webinars every month. Many, they're really great. Belgium, great. Yeah, what I love about this is it's just so accessible for people everywhere. So I'm really glad that you all could join. And again, if there are any other follow-up questions, comments, concerns, just email us at support@skinpick.com and we'll do our best to answer your questions or send you in a helpful direction. Okay. So thank you everyone for joining. We are at oh, wait, what is this? Oh, okay. One last question before yes, are there any BFRB support groups to join? Yes, 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 yes. There are many. So if you're part of the skinpick.com program, there are support groups through that program, but that is again a paid program. Um, you could look up there are support groups listed on bfrb.org in your by area. So you can see if there are any in your area that you can attend. If there are none, there are other virtual support groups. So for example, the Changemakers has a monthly, I believe a monthly support group. And bfrb.org has monthly support groups. So check them out. The BFRB UK network. They have a virtual support group as well. So there are options. Okay. You're welcome. You're welcome. Hope that was helpful. And again, just email us if you are in need of any follow-ups. And Thank you for joining, and we will chat again if you have additional questions. And oops, in about sorry, I opened the box. We'll chat in about 2 months. Okay. Thank you so much, everyone. Take care.